Dr. Tahir, can you tell us how CBD oil helps in the treatment and management of MS, multiple sclerosis?
Yeah, multiple sclerosis is again a very deep disorder. So it is again a neurodegenerative disorder. In scientific terms, it is known as immune-mediated neuroinflammation. So the immune system creates neuroinflammation in the brain, whereby the myelin sheath, the covering of the nerves, is taken off, or it gets dissolved, or whatever you want to put it. So that creates systematic symptoms. So in males, it comes as a little different. In females, it comes as a little different because of the hormonal changes. It starts as a tingling and numbness in the feet, and then slowly it goes as a graduating disease, whereby the muscle weakness is seen, and even there is disturbed sensations that can happen. The numbness can be there, tingling can be there, burning pain can be there, even total kind of flaccid paralysis also can occur. It starts from the feet, and slowly and gradually it forms itself as an ascending paralysis, whereby the body gets paralyzed neck below, and they remain in almost like a vegetative state. So it's a very bad kind of disease, and in most number of the cases, it is because of immune-mediated autoinflammation. So it is autoimmune immune disorders. So that's where you have to change your entire lifestyle. You have to look into what you're doing. You have to change, because you have to recover at the earliest stages. If you delay, then it gets too much delayed. There is not much that can be done. You can visit your neurologist, get it diagnosed. That is the first step that has to be done. And once you're diagnosed, then you have to work on your diet, which is very, very, very important. All the diet. We have a video known as endocrine disrupting agents. You can watch that. In that, we have explained systematically what are these chemicals that go into our diet, and how can we resolve that. So one is that. So we minimize the such toxin intake in us. So first thing is that. And then you need to have a healthy lifestyle. Sleep early, get a sound sleep, and then wake up early and eat healthy food, which should be low in carb and high in fats, because the fats ultimately will create the myelin sheath around the nerves. So this has to be the minimum thing that we do. Otherwise, this disease can be very serious, and the reversibility can be very unachieved. Okay. So apart from the normal therapies that your neurologist or rheumatologist will suggest, you can do add-on therapies so that we can have that nerve regeneration. Sorry. So again, it should be the 4-step protocol: diet, lifestyle, attention to the autoimmune inflammation. That is where they use some certain medications by the neurologist and rheumatologist. So we follow that. And the fourth thing which they don't do is using certain neurotropic herbs that can actually regenerate the nerves or regenerate the myelin sheath. The simplest thing of that is omega, or in the even more simplest, you want something like hemp seed oil, which will give you the correct ratio of omega-3 and omega-6. And you need to use in a good quantity, very nice, huge quantity, so that the body can build up it. Again, second thing is vitamin B12. You need vitamin B12. Third thing is alpha lipoic acid. So these are the minimum supplements which we can include. And then also for checking the neuroinflammation, we can add the CBD oil. So here, I think we, as doctors, we hold the patients of MS in high spirits, because of them, the US and the Canada actually legalized cannabis, because they needed it to stay out of pain. That's why the government agencies, they have recognized cannabis can be used for the spastic pain in MS, because it really gives a long-term effect for them. So same way, we can use the CBD oil to check the pain, to check the spasticity, to check the symptoms, to stimulate the appetite, to stimulate the sleep, and to stimulate the well-being. And apart from that, then you have to work on yourself so that the disease can reverse. All the autoimmune disorders can be reversed, provided you use those selective therapies and come out of it. Yeah.
All right, great. What is the course duration for, sir, generally?
Same thing as I told about psoriasis. So we start because there is a huge tendency for the body to have the tolerance. So that's why every 6 to 12 weeks you should keep in touch with your doctor and change the formulations if needed. If needed, we can go upscale or downscale. If needed, you can take a break and come back. And you should at least try for from 3 months to 2 years. So since you have been diagnosed with MS, so you should take time out from your usually whatever routines you have and give that time to yourself to recover. Because once you have recovered, then you can go back and have a great life. Yeah.